I'm Lindsay, and this is Andrea, and we are coming to you from the Uttyler at Palestine campus with some information on type 2 diabetes.
Type 2 diabetes is by far the most prevalent type of diabetes. Risk factors for developing type 2 diabetes include being overweight, older, and having a family history of type 2 diabetes. Type 2 diabetes is more prevalent in some ethnic populations such as African Americans, Asian Americans, and Hispanics.
Signs and symptoms of type 2 diabetes include excessive urination, thirst, hunger, fatigue, recurrent infections, prolonged wound healing, and visual changes. The diagnosis of diabetes mellitus is made through one of several different tests, including a hemoglobin A1C level, fasting plasma glucose level, oral glucose tolerance test, and a random plasma glucose level. Contact your doctor to schedule an appointment for type 2 diabetes mellitus diagnostic testing. And now for Ruby with dietary recommendations.
Thanks, Lindsay. So I'm just going to speak to you guys about diet and exercise today. And as we know, nutritional therapy is the cornerstone for treatment for diabetes, but it's also the hardest to maintain. So right here is a chart of how we balance protein, fats, and complex carbohydrates. Protein is usually about 15 to 20% of our intake. Fats is usually 200 milligrams a day, and our complex carbs is 130 grams a day. And what's important here is our carbs, because we want them to be complex, and our complex carbs consist of whole grains, fruits, and vegetables. So that would be our main focus here. Another important thing to remember is exercise. We need to exercise for at least 30 minutes a day. That moderate exercise would be like walking, gardening, but briskly walking, and things like that. So now I'm going to send it to Brittany, who is going to talk to you guys about insulin.
Thank you, Ruby. Along with diet and exercise, sometimes insulin is used to control your blood sugar as well. Your doctor will determine the type and the amount of insulin that you'll use. I would like to talk to you about popular injection sites that you'll use. One of the most important things in this process is to keep it clean. Clean the area, use fresh needles, and dispose of them properly. Popular injection sites include around the stomach, in your upper thigh, on your triceps, as well as on your lower back. It is important to frequently rotate these sites in order to not build up a tolerance to insulin in one particular site. However, be extremely cautious when using insulin that you don't lower your blood sugar too much. Once your blood sugar is lowered below a certain area, make sure you get simple sugars into yourself immediately. Once your blood sugar begins to rise, then you can start adding your more complex carbs to maintain it. A good rule of thumb for yourself or any family member that has diabetes is cold and clammy, get some candy. Remember this and you'll always be okay. Now you can move to Krista for some oral medicines.
Well, thank you, Brittany. That was very interesting. So I'm going to talk to you a little about an oral medication that the doctors are going to first start you out with. It's called metformin or glucophage. You're going to start this out at 1 time a day and probably even go up to 2 to 3 times a day, because our blood sugars may not be doing good because you may not be following the diet that was suggested here, and that's okay. So what happens with the metformin is that your body becomes more sensitive and the body tissue is able to absorb the insulin a whole lot better. So this is good for us. The only thing with this one is you may have some GI problems, meaning you may have a little diarrhea. So just wait it out a couple weeks and your body will get used to it. Thank you, and it's back to Becky.
So managing diabetes takes work, but non-compliance of treatment may include many severe consequences. It can affect the eyes, causing blindness, feet and skin, resulting in amputation. It can even cause heart attack, stroke, or kidney failure. So as you can see, compliance is critical. Now over to Destiny with some resources.
For more information on diabetes, contact your local health department or visit www.diabetes.org. Thank you from all of us.
Thank you.